Which of the following is the most appropriate layout for a dental clinic? What is the answer? Which of the following is the most appropriate layout for a dental clinic? Option A, horseshoe pattern. Option B, U-shaped pattern. Option C, valley shaped, or option D is star shaped. So correct answer is horseshoe pattern. Yes? Yes, students, am I audible? Am I visible? Yes. Now the next question is, what is the most effective method to distract a child during a procedure? See, before starting a procedure, you can go for modeling then, right? If it has been written in the question before starting the procedure, but it has written during a procedure. So what is the most effective method? Audio, visual, audio, modeling, or visual? Our answer is audio visual. See, our main aim is to reduce the anxiety of the patient. Yes, अगर हमारा patient uncooperative है, anxious है, then what is our aim? Our aim is to reduce the anxiety, right? So by distracting ऑडियो विजुअली, उससे हम क्या कर रहे हैं? उससे हम साइट एंड हियरिंग दोनों को एंगेज कर रहे हैं साइमल्टेनियसली. यस, वी आर एंगेजिंग साइट एंड हियरिंग साइमल्टेनियसली. सो आवर आंसर इज ऑडियो विजुअल. इफ हमारे क्वेश्चन में इफ बिफोर स्टार्टिंग द प्रोसीजर वुड हैव रिटन, ठीक है, तो हम मॉडलिंग इसका आंसर देंगे. यस, अगर हमारा बिफोर स्टार्टिंग अ प्रोसीजर होगा तो देन वी विल गो फॉर मॉडलिंग, राइट? यस, एम आई क्लियर एवरीवन? Coming on to the next question, which is the most effective factor in promoting and maintaining a positive behavior in a child? Which is the most effective factor in promoting and maintaining also? ठीक है, नॉट जस्ट फॉर वन टाइम कि आपका अभी आपकी जो अपॉइंटमेंट है इस टाइम पे बिहेवियर उसका पॉजिटिव हो जाए एंड यू आर नॉट एमिंग फॉर द नेक्स्ट टाइम. द क्वेश्चन इज सेइंग एंड मेंटेनिंग पॉजिटिव बिहेवियर इन अ चाइल्ड. यस, ऑप्शंस आर एप्रिसिएशन, रिवॉर्ड, reinforcement and attire of dentist. Then what is the answer? Yes, reinforcement. Correct? हमारा पॉजिटिव रीइंफोर्समेंट क्या होता है? यस स्टूडेंट्स, व्हाट डू यू मीन बाय पॉजिटिव रीइंफोर्समेंट? इन पॉजिटिव रीइंफोर्समेंट you are giving the positive pleasant stimulus to the child, जिससे हमारा जो desired behavior है to do the procedure, to do the treatment, we are able to strengthen that. yes, हमें उससे positive अगर suppose उसकी मदर उसके लिए क्या है? प्लेजेंट स्टिमुलस है. एंड इफ यू आर अलाउइंग हर और हिज मदर टू स्टे इन द ऑपरेटरी ड्यूरिंग द प्रोसीजर, व्हाट डू यू मीन बाय दिस? दिस इज द पॉजिटिव रीइंफोर्समेंट. अगर हम उसकी मदर को ऑपरेटरी में रख रहे हैं एंड पेशेंट इज नॉट अनकोऑपरेटिंग, बहुत अच्छे से वो काम करवा रहा है, यस, तो इसको हम क्या कहेंगे? पॉजिटिव रीइंफोर्समेंट. करेक्ट? तो अगर हम प्लेजेंट स्टिमुलस दे रहे हैं, उससे हम वी आर एबल टू गेट दैट डिजायर्ड बिहेवियर इन द चाइल्ड, देन दिस इज नोन एज पॉजिटिव रीइंफोर्समेंट. करेक्ट? एंड बाय रिमूविंग द अनप्लेजेंट स्टिमुलस and you are getting the desired behavior, that is known as negative reinforcement. Correct? Omission or timeout is by removing the pleasant stimulus like mother, like his or her favorite toy. Yes, उसको remove करने से अगर desired behavior is coming, that is known as omission. And punishment is giving the unpleasant stimulus and you are getting the desired behavior. Like, yes, like फिजिकल रिस्ट्रेंट्स, हैंड ओवर माउथ, यस, उसको हम क्या बोलते हैं? पनिशमेंट. So the most effective method to promote and for maintaining is reinforcement. Actually, what is reinforcement? Reinforcement is this, we are strengthening, ठीक है, strengthen the desired behavior, किसी को हटाने से या किसी को किसी चीज की देने से. Yes, so the correct answer is reinforcement. This is the, you remember, desensitization, modeling and contingency management in behavior modification. Yes, you remember all three methods. It is the core principle of behavior modification. Now, if you have any doubt, please write. If you have any query. Now, coming on to the next question. Question is saying, which primary teeth are most commonly retained beyond their normal exfoliation time? Maxillary lateral, mandibular laterals, maxillary central, mandibular centrals. Yes, the correct answer is mandibular laterals. Why? Because it has been seen कि हमारे जो इसमें absence of permanent successor, the prevalence of absence of permanent successor is more in mandibular lateral incisors. Yes, हमारे जो incisors होते हैं, they erupt, उनका path क्या होता है? Lingually, you remember, they erupt lingually. Sometimes due to the modification in their eruption pathway, they are not generating eruptive forces, so it will lead to incomplete absorption of the, it may lead to sometimes incomplete resorption of the deciduous teeth. So the prevalence is more, it has been seen that prevalence is more in mandibular lateral incisors. Yes, they are retained most commonly. Yes, the next question is, the primary mechanism responsible for tooth eruption is osteoclastic activity, proliferation of cells in the crypt, shedding of the primary teeth, and eruptive forces. Answer is eruptive forces. Yes. It is mainly related to intrinsic eruptive forces. ठीक है, जो हमारा tooth eruption हो रहा है, the eruption of tooth is happening mainly, see, the हमारा solely reason is not there, but main reason is due to the eruptive forces, intrinsic eruptive forces generated, mainly related to periodontal ligament traction and root formation. Now next question is, the cephalocaudal pattern of growth proceeds in which direction? Cephalocaudal pattern of growth, from feet to head, from head to feet, both direction, all of the above. From head to feet. Answer is from head to feet. Head, ठीक है, tail. Yes. हमारा कैसे, सी, मोटर डेवलपमेंट हमारी किस सीक्वेंस में होती है? इन्फेंट का रेशियो हेड एंड बॉडी का इज मोर, इन्फेंट हैज मोर रेशियो ऑफ हेड एंड बॉडी. यस, करेक्ट. सो फर्स्ट in motor development, first you will be able to see head control. You will see head control in the child, then sitting, correct, then standing. This is the sequence of motor control. Then walking. Am I right? Am I right? First you will see head control, then sitting, then sitting, then standing, and then walking. Clear? Okay. So, next question is saying, an infant is defined as a child of age less than 2 years, less than 1 year, less than 6 months, or less than 1 month. So, the answer is less than 1 year. Neonates are up to 28 days, or you can say 1 month. Then till 18 months or 1 year, क्या कहलाता है? What is the group of the child? What is that group known as? Infant. Yes. Then till 3 years, toddlers. They are known as toddlers. And 3 to 6 years, preschoolers. 6 to 12 years, school going, and 12 to 18 group is known as adolescent group. Yes, correct? Adolescent group. You can write also. Neonates are up to 28 days, or you can say 1 month. Toddlers are 1 to 3 years. Then preschoolers, they are up to 6 years. Then is the group known as school going, 6 to 12 years. Then is the adolescent group. Yes, clear? Coming on to the next question. In the pedodontic treatment triangle, where is the child positioned? At the apex, at the center, at the base, can be anywhere. Answer is at the apex. Yes, answer is at the apex. This is your periodontic triangle. Child, dentist, and parent. And in modified, we have society in the center. Moving on to the next question. A 3-year-old child presents for her first dental visit. She has high caries risk and her parents are well educated. What is the most appropriate initial management? See, what is the most appropriate initial management? Option A is radiographs and topical fluorides. Option B, acclimatize the child to the dental clinic, use desensitization technique, and apply behavior modification. What should be the answer? Answer is radiographs and topical fluoride. She has a high caries risk, right? And her parents are well educated, right? So they will be able to cooperate. They will be able to understand. We can educate the parents. Compliance can be expected from the parents. So preventive care is easy in that case. Yes. And early diagnosis is always prioritized, is always required. So radiographs and then topical fluoride. Initial management. The question is saying initial. Subsequently, you will go for the restorations. जो भी उसमें treatment required होगा, whatever the treatment is required in the case, you will go for that. But the initial management is radiographs, since the parents are well educated. Correct? Yeah, this is the direct question. Who is considered the father of pedodontics? Dr. Robert Buchanan. You remember? Now coming on to the next question. See, direct questions you can always expect in the exam. Sometimes हमारा पूरे के पूरे ही हमारे clinical scenario questions are not there in the exam. Sometimes you always get all the direct questions. Yes, so you can always expect direct questions. तो उसको आप all the names of the scientists, doctors, you should remember that. ठीक है, अच्छे से आपको वो आने चाहिए. How many buccal cusps are present in the deciduous mandibular second molar? 2, 1, 3, 4. Answer is 3 buccal cusps are there in. Yes, you remember? See. Now, next question is on Nolla stage. In Nolla stages of tooth development, crown completion corresponds to which stage? Stage 5, stage 6, 4 or 3? The answer is stage 3. You remember all the stages? 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Absence of crypt, 0. Presence of crypt, 1. Stage 1. And see, the easy way to memorize the stages are 0 and 1 is for the crypt, 2 to 6 for crown, yes, 7 to 10 for root, and stage 6 is important because in this stage crown is completed, formation of crown is completed. Yes, and 1/3 of the root formation is completed in stage 7 and stage 8 corresponds to 2/3 of the root completed. Yes, 1/3 of root, stage 8 corresponds to 2/3 of the root, and stage 9 is root formation is completed but with open apex. That is known as young permanent teeth, YPT. Remember? And 10 is root apex is closed. Yes? Clear? चले आगे. Now the next question is saying leeway space of Nance is primarily utilized during early mesial shift of first permanent molars, incisor liability, late mesial shift of first permanent molar, and second last option is secondary spacing of first permanent molars. ये कब यूज होता है? हमारा प्राइमेट स्पेस इज यूज्ड इन अर्ली mesial shift. And in late mesial shift, leeway space of Nan is utilized. You remember? So the answer is late mesial shift. Moving on to the next question. A 5-year-old child has bilateral loss of primary second molars. Correct? Bilateral loss of, and the age is 5 years. Which is the most appropriate space maintainer? Lingual arch? No. Bilateral band and loop? No. reverse band and loop? Yes, the answer is reverse band and loop. They have not given us the distal shoe. Yes, they have not given this in the options now. Then you will go for reverse band and loop. You will adapt the band on the D. Correct? So the loop will help in the guide, will guide the eruption of eruption of first permanent molar. ठीक है? So the answer is reverse band and loop. A 1-day-old newborn presents with a tooth-like structure in the oral cavity. What is the most appropriate management? Extract natal teeth. No treatment if natal tooth is asymptomatic. Extract neonatal tooth. No treatment if neonatal tooth is asymptomatic. So the हमारा age group क्या दिया हुआ है? What is the age given in the question? 1 day old. So the teeth must be natal teeth which is present at the birth. Correct? So if the now recent guidelines are saying if the tooth is asymptomatic, then you will not do anything. You will not give any treatment until it give any problem to the mother or to the child. Yes? Until it is not causing any trouble to mother or to the child, then no treatment is required. What is the primary function of an oral screen appliance? Promotes nasal breathing, allows air passage through the mouth, obstructs nasal airflow, and allows air passage through both mouth and nose. What is the primary function? Promotes nasal breathing. It promotes nasal breathing. What is the wavelength of light used in Diagnostic? In diagnosis of caries? 555, 650, 655, 100 nanometer. Answer is 655, which emits red light. You remember? The wavelength used in Diagnostic is 655, which corresponds to red light. A child with the thumb sucking habit may present with which of the following features? Proclined upper anterior, anterior open bite, posterior cross bite, all of the above. You remember all the clinical features related to thumb sucking habit? It will cause proclination of the upper anteriors also, anterior open bite also, and posterior cross bite also. Yes, you remember? So the answer is all of the above. And why the posterior cross bite? Due to the narrowing of the maxillary arch. A 3-year-old child with a DMFT score of 4 and 3. How is this caries status classified? Rampant caries, nursing bottle, moderate early childhood caries, or severe? It is severe early childhood caries. अगर हमारा 3 years का बच्चा होगा and DMFT score is 4 equal to 4 or more than 4, then it will be classified as severe ECC. You remember the definition? Yes, in this picture, based on the stage of dentition shown, what is the most likely age of the child? 2, 5, 8, 11. Yes, any permanent tooth, you are able to see any permanent tooth in the oral cavity? No. No permanent tooth has been erupted yet. All the teeth are primary. Yes, all the teeth are primary. Incisors also, and 6 has also not been erupted yet. So the age group must be 5 years. 5 years. What is the most critical factor determining the success of pre-implantation of a avulsed tooth? Extraoral dry time, storage media, age of the patient, nutritional status of the patient. Always remember one thing. Avulsion के case में, in the case of avulsion, in the case of reimplantation, the most important and the deciding factor is prognosis. जो भी हमारे रहेंगे, for that the deciding factor is extra oral dry time. Yes, क्या है? Extra oral dry time. So the answer is, the most critical factor is extra oral dry time. Which antibiotic is contraindicated in children? Amoxicillin, tetracycline, metronidazole, ciprofloxacin. So the mostly contraindicated antibiotic in children is tetracycline due to discoloration. It will cause discoloration in the developing teeth. It will cause staining in the developing teeth. So, which antibiotic is contraindicated and most widely used is amoxicillin. अगर हमसे widely पूछा जाएगा तो the answer is amoxicillin, and contraindicated is tetracycline. Coming on to the next question, cracked tooth syndrome is also referred to as horizontal root fracture, vertical root fracture, oblique root fracture, and none of the above. The answer is vertical root fracture. The patient will experience pain during biting. During biting anything, the patient will experience pain in cracked tooth syndrome. This is the hallmark feature, and the pain will be dull in nature. Yes, the pain will be dull in nature. What is the pH of a MTA at the time of setting? High pH, neutral pH, very acidic, slightly acidic. Answer is high pH, that is 12.5. ठीक है? The high pH contributes towards antibacterial property and biocompatibility. Antibacterial property and biocompatibility. The alkaline pH of the MTA contributes to antibacterial effect and biocompatibility. Yes. Moving on to the next question. Which of the following is the function of sodium hypochlorite when it used as a root canal irrigant? Cleansing and flushing of the canal, disinfection of the canal, and bleaching effect, or all of the above? So the answer is all of the above. It exhibits bleaching effect also. Yes, it has an antimicrobial action, tissue dissolution, and flushing ability. So it is a versatile endodontic irrigant. Which is the versatile endodontic irrigant? Sodium hypochlorite. It is a versatile endodontic due to all its properties. It has antimicrobial action, tissue dissolution, and flushing ability. And it exhibits flush bleaching effect also. Yes? Clear? I hope you all are doing great. You all are doing very, very great actually. Have faith in God. Just do your best. Just revise what all you have done. So, any doubt? Any doubt till now? Anything you want to ask? Yes, students? Komal, the answer is positive. Answer is positive. All right. All the very best for your exam. Do just do your best in the exam. What all you have done is your best. Okay, fine. Just revise what all you have done and give your best in the exam. And just don't take tension. किसी भी बात की कोई टेंशन लेने की जरूरत नहीं है, कोई प्रेशर लेने की जरूरत नहीं है. आपको सब आता है, आपने जो किया है वही एग्जाम में आएगा. यस, थैंक यू सो मच. गुड नाइट.